get going. Welcome everybody. It's brilliant to see so many people keen to attend a webinar on data. I'm not sure that would have happened 3 or 4 years ago, so I think it's really brilliant to see you all there. Really looking forward to this afternoon. I'm Christina Banks. I am the Deputy Director responsible for data assurance and support within DHSC. And I am co-chairing this with James Bullion. So James, do you want to introduce yourself?
Thanks very much, Christina. Great to be here. I'm James Bullion. I'm the Director of Adult Social Services for Norfolk, and really pleased to be here alongside Christine and overseeing the local authority showcase part. Thanks.
Yeah, it's very exciting. Let's move on. So this is our agenda for the day. So I will give you a sort of quick canter through Care Data Matters, which is our national roadmap published in draft in February, just to sort of give you a quick overview and encourage you to contribute to us. And then we're going to hear from Liverpool, Norfolk and Shropshire colleagues about how they're using data locally. And then finally, we'll have a sort of brief run through of the national tools available. Housekeeping wise, given we've only got an hour, we weren't going to have a Q&A session, but we will take people's questions offline and we will feed back to you. And there's a live link feedback form for you to fill out about today's session. So do feel free to, I say, put in your questions and we will come back to you in the future. Sorry, I'm trying to look at 2 different things at the same time, which is a little bit tricky. Can we move on to the next slide, please, Lily? Thank you. And so yeah, so today, I suppose the context for today is that from April, client level data collection becomes mandatory, and updates to the adult social care outcomes framework also go live. So sort of we're approaching a very big milestone in terms of local authority data. So given the importance of those sort of big steps in terms of transforming social care data, we wanted to get everyone together. Part of the purpose for today is for us to spotlight quickly the Care Data Matters roadmap and share how we see the national projects across data. So client level data, ASCOF, the Office of Local Government and also CQC Assurance all fit together. And then James, you're going to talk about the local.
Yeah, I mean, with the reason why we've done the 2-pronged approach here is to get a sort of collective understanding amongst us all about that national context that Christina's describing, but also just to remind ourselves actually local authorities are working with data analytics and developments in this area all of the time. So we've just got 3 examples today. We're not suggesting they are the response to the national agenda, but they are 3 good examples of how local authorities are working and the kind of things that we could be talking about doing more of in the future.
Thanks, James. And that's an absolutely brilliant point to make, that yes, we don't necessarily think we're leading the way. Lots of what's in Care Data Matters is capturing sort of great stuff that was already going on, but we do think there's a role for national government in terms of data and supporting you guys to be able to collect the right data and have really good infrastructure to share it. Shall we move on to the next slide, or probably the slide after? Yeah, let's go on to the next one. Thanks, Lily. So this is our sort of our what and why of the roadmap that we published in February. So trying to set out kind of what we're trying to achieve and why we want to do that and how we think we're going to get there. So you know, as I'm sure you're all aware, we're embarking on a series of reforms in terms of adult social care, which very much have a focus on improving outcomes for people, which I think is something we can all sign up to. We want to increase the quantity and the quality of data available, and to do that successfully and sustainably, we need better social care data. We need it joined up with health records, and we need sort of better use of digital technologies and innovation in care. So that's our vision. The sort of the why of that is very much about sort of, well, we want to be really ambitious about this. So this is a 5 to 10 year programme, and we really want to really transform how data is working in the adult social care sector. We think if we get this right, we can make a really, really big difference in terms of the outcomes that people who draw on care and support can hope to gain from the support they're getting from all of you. We really think that we can deliver more joined up care for people. We also think there's sort of that actually better data and better technology help to release time and resources so that people both in local authorities and within providers actually have more time to spend with the people that they're seeking to support, which feels like a really important gain. We really want to get to a point where inputting data is not a massive burden on local authorities or on providers, and that also actually it's not something, I think it's also really important that it doesn't feel like something that's then sort of used against you, that it's something that helps, that gives insights across national, regional and local government and within providers to really improve what's being done to support people. We think we need a better understanding of people's care journeys, and that's both people who draw on care and support, but also for unpaid carers. We think there's probably, well, we know there's good practice out in the real world, and we really want to be able to find a way of capturing it and evidencing, you know, what is good and what is working and what difference it's making. And then there is also, you know, with the introduction of CQC assurance, a part of this, it's about better management and oversight of the health and care systems, both at sort of local, regional and national level. So there is a bit about us understanding what all of this adds up to. And I suppose I think one of the things that we struggle with every time we come to spending review is being able to evidence the sort of true cost of providing really good quality health and care to people, and actually really sort of evidencing things like the increase in complexity of demand. And so we really see having better data as one of the bits of the tools that we will have in our armory when we go next time and in the future to make the case for resources for adult social care. Can we move on, Lily, please? Thank you. So this is a big journey, and it will, as I say, it will take time. Sort of along the left-hand side of this are the problems in a way. So we don't have much digitisation. We don't have that much data. We think there's duplication. There's a real lack of standardisation. We've been talking a lot about waiting times and how you can measure them, and it's incredibly difficult to work out how to do that. But at the moment, that sort of lack of standardisation makes it really hard to have a really good picture across the country of what's going well and what isn't going so well. And then we think there are some significant data gaps as well. So what we've tried to do, we've set up a number of national projects. I'm not going to talk through all of this in detail because you will have access to this and I think a slightly more complicated version of it as well. But I just wanted to sort of say we're putting things into 4 buckets, I suppose. So the streamlining and improving existing data collections feels like a really important thing to do, and client level data is a really big part of that. But also improving provider level data, which it's now mandatory for providers to give us some data. We want to make sure it's the right data, because at the moment it's very sort of COVID flu focused, and actually I think in the longer term we want it to be a bit more about sort of the quality of care workforce and how we're sort of meeting people's needs. And then the sort of second bucket is about some new data collections, but doing that only where absolutely necessary. So the social care workforce survey and the survey of unpaid carers, which we think we need to sort of invest time in making really good quality products. And then improved access to data and better insight. So what we don't want to do is create a system where we're just sucking up a load of information into the centre and then never sharing it back with you or telling you what we think it means or any of those things. So we want to create something that collects data from lots of places, adds some analysis and shares it back out in a safe and appropriate way. And then sector digitisation. So we're also investing in creating digital social care records and supporting the provider sector in particular to digitise more, because we think it's a very paper-based sector in lots of places. That creates a lot of work and it's not actually very useful to others. So we think they're the sort of big buckets of work that we're engaging in. I just wanted to mention quickly the SALT collection, because what we're trying to do is create a more granular, timely national data set that will enable more real-time benchmarking and allow health and care data to be linked. And so CLD becomes mandatory from April, but we are co-running it with SALT in the first year. We're going to have some updates to the Adult Social Care Outcomes Framework going live in April. They're to make sure that ASCOF reflects the current data collections. And so for example, ASCOF until now has not been aligned with the Care Act. So it felt like there was some sort of really fundamental changes that we should make to it. But we also want to create a second phase of ASCOF, which will happen from April 2025, which will be able to reflect the fact that there will be much more data in the system by then, and we will be sort of partway through the roadmap. So we think that it's sort of worth having another look at it at that point. But we just didn't want to miss the opportunity of doing something sooner than that. And there's an annex, in the annex there's a timeline for all of this. So can we move on, Lily, to the next one? So then there's a sort of, so what? We've really heard from you that you want to know how data will be used. And I think you hear quite a lot from providers, a real sort of concern as well about how we would use data. So partly how we use it will evolve as we understand data needs better. And that's why we're really keen to get your feedback through the roadmap consultation. So please do offer us some feedback through that. And importantly, transforming adult social care data is also about how we get value out of the data. So to enable us at national, regional and local level to tell the adult social care story better, and ultimately to deliver the best possible care for people. So be that through understanding the types of services that your people use, changes in demand, new commissioning insights, and that sort of thing. So we really want to be able to sort of capture what's, I suppose, the innovation going on as well in the sector, and be able to share it. How we use the data, we really want to be focused on driving better outcomes for people. As I said, we've really heard your concerns about how the data is going to be used, and I think sort of client level data is a really good example of that, where we've heard really sort of loud and clear concerns that in its first year, as we seek to standardise definitions and we seek to sort of make sure the system's working well and we get everybody on board with it, that it's not going to be a perfect data collection from day one. And we have done a lot to manage the expectations of our senior colleagues and our ministers, that kind of on the 1st of April we're not going to flip a switch and just have, you know, a huge amount of absolutely fantastic real-time data. But I suppose I think we can hold people off for so long, and then people will start to sort of get impatient about it. So I suppose it's a sort of plea to you to really help us to get our definitions right, and help us to roll this out in a way that gives us all really good quality data sooner rather than later. And we've set out on this slide how data is going to be used at different levels. So in terms of nationally, we think better information on activity, resource and outcomes will allow us to evidence the what, how and the impact of adult social care. So going back to that sort of spending review discussion with the Treasury, we think it will really help us to do that. We think it will also improve our national publications, so the user and carer surveys, SALT, the ASC finance return, all of those things we think we can improve, and they will help us to understand what's going on, and also promote transparency, which fits with our sort of CQC assurance work as well. Sort of how are we allowing people in our areas to understand what's going on. A few specific things to talk about. So plans for activity data currently sourced from SALT returns will be calculated from client level data after 2023-24. So this year we're running it together. recognising that data takes some time to get right. 6 ASCOF measures will be calculated from CLD for 23-24, and they'll be badged as experimental statistics. So really sort of encourage you to have a look at those in particular. And then CQC have committed to using publicly available data as much as possible to reduce the data asks on local authorities. So they can apply to have pseudonymised CLD data from us from July this year, and we will be able to share that with them. We're working really clearly with them to make sure that they understand the conditions of use, and they understand the limitations that we think there will be in that data set at the beginning. So I don't want you to panic that sort of what's in CLD is going to be the sort of be all and end all in terms of CQC assessment. But I suppose it's another sort of encouragement to really focus on us collectively getting CLD into a really good state in its first year. And then we're also working closely with DLUC on the co-design of the Office of Local Government and the metrics for that. So our intention is that what is collected by by central government is collected once rather than collected in multiple different places, that we should not be duplicating. The DLUC are very keen for adult social care to be a sort of trailblazer in terms of data because of all the work that's going on at the moment. So we're excited about that, and we're working very closely with DLUC to come up with the sort of right set of metrics. And I know at least some of you have been involved in conversations with DLUC as well. So it's being done very much with the sort of co-production with local government in mind. And then regionally and locally, we want to sort of offer more support with analysis. So to give you better insights through sort of benchmarking linked health and care data and easier ways to see those insights. So through some national tools, the support of LG and ADAS, so their Partners in Care and Health programme, and regional dashboards also have a data focus as well. So I think together there's a sort of real coming together of lots of different bits of activity that will support us collectively to improve our understanding of data and give us much more insights into how the sector's working. Right, I'm going to stop there. I hope that was helpful, if rather speedy. And I think let's move straight on. I think I'm handing over to you, James, aren't I?
Yeah, thanks, Christine. Excellent stuff. I mean, we really welcome this care data matters framework, but it's big changes for local government, and in that context of trying to understand care journeys and trying to join things up and trying to get stronger oversight. I think we've got 3 examples of current data use, which we're going to profile now in the meeting. So straight over to colleagues at Liverpool. I think we've got Anne-Marie and Rikshand and Adam talking about work in Liverpool. So I'll hand over to them. Thank you.
Thanks, James. It's just myself and Adam today. Thank you for inviting us to share how we've been trying to use our data. We use our data through Power BI, and we've been doing it, trying to think forward in terms of all the things that Christina went through and some of the challenges as well. But I'm going to focus on, well, Adam is going to focus on what we've tried to use the data, because obviously data is and so what. And we've been very keen to get it into a very much bottom level up as well as top level down, so that actually operational teams can see the data at any point, because what we will show you is how we move into very live data. The last slide in our pack is something that I go through every month with team leaders upwards to talk about how we spend, the activity, the productivity, and link to spend in terms of savings plans that we've got also. So I'm not going to speak, so I'd really like Adam to go through our slides. Thank you.
Okay, I'll just start off with a eye test of a slide. We're not going into too much detail, but this is around about a fundamental move away from how data is utilised in silo, which it currently is. So you'll have your SALT return, you'll have ASCOF, etc. And these are all pockets of data that are pulled together. Now, the idea behind client level data is that it is a component of a broader singular data set, and it's moving from these isolated pockets of intelligence to a single version of the truth that acts as the foundation for all information and intelligence that flow through a system. That singular point and that singular resource can then facilitate and enable a lot of the extra information that goes from operational straight up to strategic, and it gives you that ability to trace all of this intelligence, all the decision making back to cases, back to the reality, and back to the outcomes of individuals. This is just a general overview of that. So if we move on to the next slide, what that single pot of information allows us to do is overlay a performance standard with the importance focused on establishing what the outcomes are, the individuals, and it's about converting that available data into workable intelligence, and how does that feed through the system. Now, this is just sort of putting forward some of the philosophical principles of how we're utilizing data, and especially client level data. But it does give you a broad understanding of the level to what you can go to. It's not just a strategic overview, ask off, etc. It is down to operational level and what they mean on the ground at the front door. So if we move on to the next one. In order to turn this into intelligence, we need to triangulate across the board 3 key areas: demand and activity, productivity and effectiveness. What do we do? How do we do it? And what value does it provide? Now, that value is broken down into 2 key components: your social impact and your value for money. Are we making the best use of our resources, and are we maximizing the outputs and social impact for individuals who ultimately, that's the goal. That is the key metric we're trying to get towards, is are we producing the best quality of life we can with the available resource? The next few examples are around how we utilize this in a very pragmatic way. So on the next slide, this is around activity and demand. Now, this is a sanitized view of what we utilize for our hospital discharge pathway management. It allows us to have a look at the integrated data flows, and this pulls in information from partners in health, the acute trusts, our mental health partners, as well as community health partners and our own information. And if you're interested, this is sourced from Liquid Logic and Contract from a local authority perspective. But what it allows us to do, if you're moving from left to right on this, it gives you your discharge information, who is sat in the acute, who's waiting to come out at any given day. And we get updates sent across twice a day on this one, but it allows us to see what's that first milestone, who is our demand. We can't always control demand as a local authority, but we can control the activity that responds to it, and we can see what the reaction and impact on resources that is. In this instance, we split this out into who's onto waiting lists, either for domiciliary care or community care, or bed-based care. And that splits out into individual services, looking at throughput, flow, amount of resource in situ, any delays that might be in that area that we need to prioritize, and allows you to mitigate risk at an operational level. This report drops into a meeting each Thursday morning, and we run through it with operational team leaders to see where we're up to, and we have some accountability behind this. That's the activity and demand element of this. Every single one of those numbers is based on a case. So there isn't any additionality of function in this. It is simply a visualization of data that already exists. So if we can move on to the next one. This is about the outcomes. Now, this is where client level data really does have some power, because it allows you to build a chronology per person. It allows you to build a timeline for every intervention you've had for an individual, which means you can derive outcomes, you can derive the before and after, you can derive the impact of intervention. Escalate that up and scale it up, and you have a integrated data set with acute information in it, mental health information, community impacts, signposting, universal services, etc., integrated, and you have a birth to death chronology for every person who comes through the door. That gets you some really powerful ability to see the outcomes for social impact as well as value for money. It lets you strategize about moving interventions upstream. It lets you see what types of interventions work better than others and in what circumstances and scenarios. It is a really powerful tool. Now, a lot of the new ASCOF metrics around better care fund and that flow talk about 91 days and sequels and outcomes to pathways. This is how you derive them. It isn't a standalone one-off function that you do. It is a live system, and you can change this up. At the moment, we've got this set to a 7-day outcome. So 7 days after hospital discharge, where's that person at according to our data? You can change that to 12 days, 15 days, 28 days, 6 months, a year. You can see how long an intervention would ask for. It gives us a really clear view of the impact we have in terms of outcomes. So if we move on to the last slide, please. This is about the final part of that triangulation, that's resources. This is what Anne-Marie referred to before. Once a month, we sit down and we have a look at what our utilization of resources and budgets are for specific areas. And this is about commission behavior. This isn't about plan versus actuals or spend. This is about how we commissioning and building support and care and support. How is that transitioning through the system? On this instance, we can break it down into various sort of catch-alls and broad sort of categorizations of services, moving from least intrusive down to most intrusive at the bottom, which is, you won't be able to see it on this slide, but that bottom one is residential and nursing settings, up into supported living and complex needs, then into community, and at the top is your short-term services, reablements, etc. What we're able to do on this is create a couple of snapshots and essentially say, at the 1st of April, what was our day in the life in terms of spend? And then at the midpoint, which was a secondary baseline, what's our day in the life spend 6 months in? It allows us to give an indication very quickly of the direction of travel of spend by service type, but inversely, you can replace all of those service types with your individual teams, geographies. You can break it down very, very quickly by whichever categorization you want, because the foundation of data is there to do so. And it just gives a very transparent view of behaviors and spend and your utilization of the available resource to meet demand and need. So that was just a quick whirlwind tour, and I think I've hit my 10 minutes. But I think these slides are going to be circulated, and we'll pick up anything if you need any queries, I think, after the fact. Thank you.
Thanks very much, Adam and Anne-Marie. I'll take the chair, as it were, because the next example is Norfolk, and very similar actually, and very interesting to contrast with Liverpool. So if we go on to the next slide, in Norfolk, we built a dedicated information and analytics team alongside our operational teams to try and re-understand how business as usual is working. And if we move on to the next slide, we've always been, and the next one, we've always been pretty good at understanding our residents and the instance of casework in Norfolk, but until we've properly implemented at client level functionality across the whole of our systems and some report writing suites, we've never really had the ability to do granular level analysis. And so in the next slide, we too have focused on comparing discharge pathways in real time and taken a really good look at which of our service users are in which pathway and how they switch between them over time by looking at live data updated every hour on the system. And that's allowed us to, as it were, start to develop thinking around cohorting of people and looking at customer journeys. And on the next slide, we have being able to take a series of care journey exercises to look at what's the cohort of people on the left and then what's the individual decision made on the right, and start to ask ourselves the questions about, well, what if there had been alternatives for people? Would we have made a different decision through this care journey pathway based on the data? And that functionality now is built into the whole of our systems for all of our managers. And moving on to the next slide, the kind of feedback we've had from middle managers and from teams has been really quite surprising to me as director. This is not an activity that we've tried to keep to the performance team and the informatics team. This is something where we've tried to get every single manager and every single team meeting looking at data in a different way to look at customer journeys. And on the next slide, we have got a finance and performance board, and we have introduced recovery and learning cycles in our teams on a weekly basis to look at who's in our backlogs, who is waiting for service and why, and can we change the way we practice and get different outcomes, remembering that care journey tracker, as it were. And so we've been looking at what collaborative case discussions or multidisciplinary team discussions would have made a difference to somebody ending up in home care, residential care, or in a different part of the pathway. And so we've introduced this functionality and this way of working with our staff. And moving on to the next slide, and the next, we've recently been looking at taking that functionality, taking that way of working, and looking at our front door, for example, and asking ourselves the question, is it preventative enough? Could it work in a different way? And what are the outcomes for people? And what does the data tell us about our readiness for change? So using, again, the functionality, and moving on to the next slide, by tracking the pathways and by looking at the client level based outcomes, we're able to see that half the people who come through our front door could have had a more preventative outcome. And 30% of those preventions aren't in the traditional service lines that client level data is often focused on, residential, home care, or health care. So actually we need a different way of approaching it. And that's led us on the next slide to, the next one. That's led us to a sort of different way of thinking about how we put the notion of statutory returns, commissioning information, client level data, and customer journey tracking into a single framework for us to think about how can it not just give better oversight, but also give us an ability to transform and to change. And that's the Norfolk example. I've rattled through that, I realise, but hopefully people will get an opportunity to look at the slides later on. And I think I'm handing over now to Andy and colleague in Shropshire and West Midlands to give us your example. Thank you.
Thanks very much, James. So it's Andy Begley and Pete Jackson. We're located at Shropshire Council, but representing Shropshire Council in the West Mids, I think. That sounded like the Eurovision Song Contest entry. I do apologise. I'm going to rattle through some slides at a fair pace. I'm just aware of the time. What I want to do is just give you a whistle-stop tour, I guess, of what we did a few years ago, what we're doing now, and what we're planning to do in the future in relation to data and how we think about it. So I guess it all started, as Christina said, 3 or 4 years ago. We're going back to 2018, when we started to try to create a different narrative, a different focus around social care. And this was an antidote to social care being that black hole that consumes all resources and just costs authority, budget after budget after budget. So what we tried to do was create a narrative that flipped social care and talked about social care being a driver of local economy. And to that end, we commissioned an ADAS report there around basically an analysis of the local economy and what does social care drive in terms of employment, in terms of GB, all that good stuff that we know about. And we can move on to the next slide, please. That ended up into what became and what's still kind of a campaign almost around flipping social care, and did change that narrative and allowed us to have very different conversations. James, I think you and I were involved with particularly around ADAS conversations at that time in relation to this. But what it did, it helped us to bring lots of different data sets together, start to overlay them and start to think about the connectivity and think about it in a really different way. And it was really important because it came from an economic perspective. We didn't just focus on what's traditional service data and traditional either reporting requirements of social care and councils, and it was much more around data that's on the periphery of that, outside data that you wouldn't necessarily think about looking at, but when you started to bring together and onion layer it, really was terribly informative. So again, stepping through really quickly, we go on to the next slide, please. I'll draw a breath in a minute, I promise. But what we did as part of that is we created something called the Bridge, which is a 3D environment. People describe it as a yurt, rather ungenerously. It's probably a 12-foot diameter indoor tent that we project information on the walls. The bottom right there, you can see a picture of what those projections look like, and you can fit about 20 people in that environment. What it does is it just puts information, performance data, it visualizes it in a different way for people. It's a really immersive experience, and commissioners and other people who aren't necessarily turned on by spreadsheets and not quite engaged in that sense, engages them in a new way. It really does involve people, and strange things happen when they're faced with data at kind of 6-8 foot tall information. It's really has a profound impact. Lots to talk about in relation to that, but the one I'm going to focus on is something that ended up into a strangely named campaign that was christened Finding Dave. And what this was about was using 3 data sets to then model to proactively identify people before they came in touch with our services. So when I was looking at the kind of information we kept as a local authority, for some unknown reason, we had grant funding a few years ago that allowed us to pay for thermal imaging of the whole county. So of one particular cold evening, January evening, a plane went up and down the county with a thermal imaging camera. And that basically, that information, it sat on the website. You could look at your own house. You could find out how thermally efficient your particular house is, how much insulation was working, or whether you got a cannabis farm in the loft, because unfortunately we found a few of those as well. But the point is that information sat on the website and did nothing. So what we did is we brought together that information. We brought together the information that we held on individuals, i.e. we were interested in those people who were over the age of 80 years old, and we were interested in those people who lived alone, and then those people who were 80 who lived alone and lived in a thermally inefficient house. Because you put those factors together, and what you find, most older adults who live in a thermally inefficient house will heat one room because it's cheaper and more effective, and they won't move very often, so they won't hydrate as much as they should, and they certainly won't use the toilet as much as they should, and even if they do, they're likely to slip and trip. So the likelihood of those individuals acquiring a UTI is pretty high. So my conversation with clinicians at the time was, if you're over the age of 80, live in a thermally inefficient house and you live alone, chances of you rocking up at A&E in the next 12 months with a UTI are about 80%. And most people were happy to agree with that. At the same time, fire and rescue services were saying, we want to do our safe and well checks, the old smoke alarm checks, but we want to do more with that. But we need to know the people to talk to. So what we did was triangulate that information and asked them when they were doing the safe and well checks, could you please knock on these houses, these individuals, and just check on a few things for us, so we could address thermal inefficiency, we could provide grants, we could insulate homes, we could put temporary heating arrangements in place, we could make sure people aren't socially isolated. Can't do anything about the age, but those are the sorts of activities that we did. So we identified people at high risk before we even knew them in the service areas or in health or social care. And we managed to do some proactive work that then reduced the chances of that person turning up at A&E to about 20%. So you can see there, broadly speaking, a 60% improvement in reducing, managing or stopping demand coming into our services. And that was about applying 3 data sets that we never thought about kind of looking in total. So I'm being really quick, but that was just one example of how we've used data, how we've used data visualization. We've got others where we employed gaming engineers to help us with what does commissioning look like, what does the economic bleed of commissioning look like within social care, all sorts of good stuff, but we've not got time to talk about all that. But I just thought that might pique people's interest, and that became something called Finding Dave. And we're still using Finding Dave as an analogy about how we use information, how we really get into early intervention prevention space. I'll just hand over to Pete now to tell you about what they're doing now and in the future.
Thanks, Andy. I've just got a couple of minutes really to make 3 or 4 points. First one, looking at the data that we've assembled together, we coin this term infobesity, and when you're looking at some of these slides and some of the slides we've seen already today, you sort of get overwhelmed, and I think for many people that there's actually too much data, isn't there? What we all are chasing is actually analysis and information that helps us to turn that data into information that's going to impact on people's lives. One of the things as well, terms that we use often is about count once, use numerous times. That often we've got data that's appropriate for all sorts of different audiences, and we have it stored in all sorts of different places. So what we've built in the West Midlands is what we've called our knowledge hub, where all of the nationally available data sets are held in one place, and people can go in and use and cut and paste literally the data that's appropriate for their council, their neighbourhood, or their region. And then the third thing that we've tried to do to try and simplify how we talk about data is sort of talk about data that we use for assurance. In fact, I'm in Shropshire today doing a CQC readiness review where we're using data that we've collected as a region to test out Shropshire really in terms of whether it triangulates with their story of their performance. So we're using data for assurance, and then also using, of course, data for improvement. And part of our reason for being often is around how are we managing to project forward, to benchmark, to compare with our neighbours, to find out who's doing things that are better than ourselves, and how do we steal with pride, as we say. So data for improvement. And then the third area, which is probably where Andy's input has been, I think, most inspirational really, has been around data for innovation, data for social care to start thinking of itself in a different way about how the information that it holds and how it uses that to look into the future, to start to think about prevention, early intervention, some of the links that our services make with the wider local government, health, economy, locally, regionally and nationally, and go back to that whole thing about social care thinking, flipping social care, thinking about social care as an asset rather than as a deficit for the local authority, but for the government nationally. So some very quick lessons that we've learned, but I think something which we're really proud of that we've built in the region, obviously cooperating very much with Shropshire Council and Andy and his leadership.
Great, thank you, Andy, and thanks, Pete, and thanks earlier to Adam and Anne-Marie. I hope, colleagues, you feel that those examples, not only do they demonstrate local government's capability and really what ought to be its confidence in this area, but also they are good examples of information efficiency, outcomes focus, and in the latter case, innovation that we can use, and they're part of that picture that we have to have in terms of care data, as well as the oversight that the Care Data Matters framework will give us. So I think the last part of our webinar, we wanted to focus on the tools that are available. And I think, Christina, it's yourself or a colleague leading this.
Yeah, it's me again. So yeah, I mean, this is a tool that we're seeking to develop rather than a tool that exists already, but this is our sort of part of our ambition in Care Data Matters. So we know there are lots of great local and regional tools, and we've just heard some brilliant examples, really sort of inspiring examples of how some of you have designed an incredible information and insight. But we also know that not everybody has got the capacity to do that. So we think there is merit in us trying to create something at a national level that will allow you and others and us to access and analyse data in order to support the local authorities that just don't have that capacity at the moment, but also to allow us to sort of aggregate things up, so you can look at national level or you can look at regional level and really understand sort of in a better way, sort of benchmarking and helping us to develop, I say, our pitch for what resources are actually needed in adult social care. So we've set out some initial design principles for the tool that we are trying to develop, and we're about to go into discovery. In the short term, it will use client level data as an input, and we'll develop a prototype for testing in the summer. In the long term, our learnings from the tool will contribute to a single national social care data access solution, we're calling it now, for local authorities and care providers. We've been through various names for it, but it's all complicated and technical, but you can't call it a platform or a portal, so it's now an access project. But we really want to work with you as we design this, because it's really important to us that we create something that's useful to everybody. So sort of really encourage you to get involved. Thank you to everyone who's already registered via the CLD Pulse survey, but do let us know if you want to be part of the development of that. That's all I was going to say. I think I'm handing over to you, Philippa, now to talk briefly about LJ and ADAS.
Yep, thanks, Christine. I'll be very quick with this because I'm conscious of time, but there are a number of links in the slides when everybody gets them, so you'll have a chance to go back and reflect, and particularly have a look at some of the tools. So just as a quick introduction, I'm part of the Partners in Care and Health programme, which is joint between LG and ADAS, and it's to support sector-led improvement for adult social care. And as part of that, we do have a data and intelligence offer, which is starting to grow a little in terms of the resources and also its integration across the wider support offer. We can just go to the next slide, please, Lily. Thanks. So the key things to say about the data and information support is that it's not a standalone thing. And one thing that I've said throughout the programme is that it's got to be integrated with the wider support offer. So it's got to be embedded in the topics or the themes that we're looking at, to really bring data and intelligence to have a purpose in supporting and evidencing and informing improvement and understanding of what's going on locally, regionally and nationally. The tools that we've got, they're not meant to replace what's going on locally and regionally. As we've seen, there's loads of fantastic exercises going on, and it's really about getting people to interact with data, using being aware of the insights that's there, and really using it to start to have those conversations and to help it to evidence and inform their work. So everything that we're doing is to complement what is also going on locally and regionally, but trying to make sure that we've got that consistency and that flow, and that we're not duplicating effort where we don't need to. So I'll just go quickly onto the next slide. We've got a number of different components to the offer, so I'll just very briefly go through the tools, which with a lot of the work that we do, we've developed a number of self-assessment tools, which are really built around good practice, methodologies that have been looked at in the different themes. So they're not led by data, but what we've tried to do is to develop structured ways for councils to interact with any guidance and self-assessment, so they can work through the guidance, compare themselves where they need to, bring together different views. So it's a key part of our offer where we use survey tools to allow people to work through good practice in a structured way, assess themselves, and then evaluate and compare and get conclusions. So a few links here. They don't look like links, but they are links. But please have a look at those to get a sense of some of the tools we've got there, and of course we're developing a pilot one, or we're testing a pilot one for assessment for insurance as well. So they're the tools. If we just go on to the next slide, and this is really the key part of our offer in terms of underpinning the wider work that Partners in Care and Health do. And we have a platform called LG Inform, which some people will be aware of if you're into data. Some people are still oblivious to it. It's been around for over 10 years. It's a benchmarking platform that is built for local government, and essentially it has thousands of metrics across all local government services, but also a lot of things around the economy, demographics, determinants of health. But all the data in there is at a local authority level, and if there is time series data, it's all linked there. So it's a very powerful platform, and you can interact with it to the extent that you want. So for some councils and regions, they might just want to suck the data out and put it into their own tools. At the other end of the scale, we have a number of report writing platforms where you can build your own reports and really visualize the data in a way that people who are not into spreadsheets, not into charts and tables, can interact with it in a way that makes sense, so that we can get the story out there. And that's really what we're trying to do within Partners in Care and Health, is to use the data to create that narrative for social care, so that the non-technical people, the non-analysts, can really understand what's going on and start to ask the questions. So within LG Inform, we've got loads of adult social care data. This, I don't know if you can see my mouse going on here, but the second bullet point there is a spreadsheet that has a list of all the metrics there. So if you're starting to look at what intelligence you want to use locally or regionally, it's a good start to understand what is in the report, in the platform. And we also have a number of ready-made reports, the link in the third bullet, which you can interact with. The reports are built in a way that allows you to compare with a number of ready set benchmarking groups. So it could be your geographical neighbours, your similar neighbours, your regions, and so forth. And you can interact with the tool, so you can look at different councils. So it's a very clever, sophisticated tool, but very simple as well in terms of how it's used. And you can take stuff that other people have created and then adapt it for your own use. But it's once you've created reports, then the reports themselves will stay dynamic, so that if data gets updated, and particularly as we're going to the client level, which will be more frequent, the reports are constantly there and updated for you to use. I think we can go on to the next slide now. So this is just some of the visuals that are in LG Inform, and this is really the beauty of the tool. It's not just a load of charts, it's that ability to really interact with the data. And I think probably my favourite component is on the right-hand corner, where you can embed data within the text. So you're really getting people to engage with the story and not just look at the old-fashioned tables and charts, that you can really build that narrative and build in the data, not just values, but look at comparisons within the, look at direction of travel. So really try and bring the data to life. So it's a very adaptable platform to use, and personally I'm very excited with the client level data, and hopefully we can start to bring some of that insight through creating reports that we can all engage with, really to start that conversation and to start people to get familiar with the data and to start using it and asking more questions of the data that's available. So I think the next slide is just a lot of reports for you to really go and play with and engage with. And please, my contact details are on the next slide. Happy to work with councils and regions to try and build more material that we can use, because once it's there, it's readily adaptable and brings the insight to life.
Brilliant. Thank
Just
you,
in time.
Corey. Thank you. Well done. Well done. I was going to say, wow, we have packed a lot of stuff into just less than an hour. So a huge thank you to everybody who's spoken so briefly, but with so much kind of information and passion, and sort of really, getting that sort of point across about how data can feel a bit dry if you don't think about it in a sort of, what difference does it make to real people? How does this inform, how we improve things? So it's been really, really inspiring, and I'm incredibly appreciative of everyone who's spoken. So Norfolk, Shropshire, Liverpool and Philippa, really appreciate it. Huge thank you to everybody else who's joined and is also working on data. Do please get in touch with us in terms of the data saves, no, sorry, the Care Data Matters consultation. Really keen to hear your thoughts and continue this conversation. And I'm going to finish it there. Thank you, everybody.